would you recommend to, I would say, a neurologist in training, to a neurologist who works in a private practice? What is for you the most important point to treat ICDs?
One, find a good psychiatrist that you can collaborate with, because I think it's too much to ask a neurologist to do all these things. But unfortunately, that's hard to do because people like me that focus on Parkinson's disease as a psychiatrist are not common. So most neurologists are going to have to either rely on what they're able to do or referring to some general psychiatrist somewhere that they may or may not be in close contact with. I think there has to be a better way to implement screening, and this has been a focus of research for myself as well with others, kind of across psychiatric symptoms or non-motor symptoms broadly, and to do that in a way that's not burdensome to the neurologist. So we've been involved in developing rating scales that can be self-administered by patients. They could be self-administered in advance of a visit. It could be completed not only by the patient but by a care partner. So this would arm the clinician with some information at the time of their assessment without having to go through a huge checklist of symptoms that's not practical for them to do in their typical clinical appointment. So I think it's primarily just being able to somehow assess these symptoms and make sure you're not missing it. I think once you do that, the management strategies are fairly straightforward, either adjusting the Parkinson's medications, considering referral, for deep brain stimulation, which may allow for adjustment to the PD medications if the person's appropriate for deep brain stimulation. You can try psychiatric medications, antidepressants, antipsychotics. These are relatively easy to do. So I think the management is less complex than just making sure you identify the problem before it gets out of hand.